All right, committee members, we certainly have more speakers signed up than time allotted. So what I'm going to do is I'm going to go through the first 15 speakers, and Dr. Presley has prioritized those speakers. So I'm going to call them based on how she's prioritized them, and then see what kind of time we have, because we actually need time for the committee to discuss and or take any action. And so that may require interaction with you all, the speakers, as well as interaction with staff. So we'll get through the first 15, kind of see how that goes. I do want you to be heard if you're here to speak on this item, but we are faced with some limitations this afternoon. So with that, and if you don't need to speak, you don't have to. You can waive that ability. And you don't have to repeat what's been said as well. But nonetheless, you are free to speak. You are free to speak. You can repeat all you want if that's what you want to do. So the first speaker is Marian, is it Malotak? And please correct me if I mispronounce your name. Malotak, welcome.
Hi, I wanted to speak to putting a warning on the water bill about fluoride. We get fluoride from a number of places, and we can get fluoride in our toothpaste. Fluoride's in the water because the city is fluoridating it. The fluoride that we fluoridate the water with is a toxic byproduct of the fertilizer industry. And as far as I can tell, it's basically really behaving as a poison to a lot of people. Anybody with any kind of kidney impairment is going to have more difficulty if there's fluoride in the water, and they'll have to remove the fluoride. If people are given dialysis, then the fluoride gets filtered out before they're given the dialysis. I personally would like to speak to osteoporosis, because I do have osteoporosis and I've been diagnosed with it, and fluoride not only impairs the look of fluorosis with the cosmetic browning of the teeth, but it also impairs the bone, and it does the same kind of thing as some kind of medications, which is basically not allowing the segments of the bone that remove old bone to be removed. So you're getting more brittle bone when you have fluoride. And so even though it may not affect the density of the bone, it's affecting the flexibility of the bone, and you're more prone to breaking your bones. And I was in an accident not all that long ago where I broke 3 of my rib bones, and that's not so bad. It was kind of painful, and I still have some impairment from it with certain motions. But, at my age and getting older, it's something to worry about for breaking a hip, because a lot of people who break a hip don't survive a year from then. Or if they survive, they need help for the rest of their lives. So this is a great, great concern, I think. Osteoporosis is probably way underdiagnosed, and adding fluoride to the water simply exacerbates the problem. You have a lot of risk factors for osteoporosis, being white and thin are 2 of them, which I am, but also eating sugar, eating a lot of protein, and that tends to be the American diet. So, there is a lot of sugar in our diet, and there is a lot of protein. I personally can afford to filter out the fluoride from my water, but there are a lot of people who are not in a position to do that, and I'm really speaking for all those people. Thank you very much.
Thank you, Ms. Belotok. Our next speaker is Carol Vandy Stoy. Is that right? I'm sorry? Oh, I thought that was 2 words. I'm sorry. Welcome, Carol. You have 3 minutes.
Thank you very much. I think most of you all know me as a dental hygienist and a writer and speaker on oral systemic medicine. I was looking at the audience, and I think we have about 100 people here. Out of 100 people, the Centers for Disease Control would say that 17 of these people probably have chronic kidney disease. That's the statistics on it. And most of them probably don't know it. 26 million Americans are at risk for chronic kidney disease because they're either obese, they have diabetes, or they have high blood pressure. One of my specialties is the study of inflammatory diseases, which is basically diseases of blood vessel walls. So diabetes is an interesting one to discuss because those of you who have or know somebody with diabetes know that they have to have a test every 3 to 6 months to see how their sugar control is. But you may not know what that is actually looking at. What it's looking at is insulin's job is to, when you ingest sugar, you squirt out insulin, and insulin takes that out of the bloodstream. Any sugar that is not removed from the bloodstream immediately is going to permanently link onto red blood cells, fats, and so on in the bloodstream. And so what they're looking at is how many of these ruined red blood cells you have in your circulatory system. It makes the red blood cells large and sticky and sharp, and as they bounce along the walls of the circulatory system, they cause damage. That's what cholesterol goes to repair. But the biggest damage they do is to places where capillaries are heavily embedded. That would be the eyes and the kidneys. So that's why I think about a third of diabetics end up with chronic kidney disease because of all the damage that occurs to their kidneys. When a person drinks, whatever, your kidneys, a normal healthy person can excrete between 50 and 70% of all the fluoride that they intake. A person with kidney disease can only excrete between 10 to 20%. The rest is retained in the body. It's retained in the bones, it's retained in the joints, it's retained in the pineal gland, and it's retained in the kidneys. For soft tissues, the kidneys are the place that it accumulates the most. The more kidney damage you have, the more you're going to retain. The more kidney damage you're going to have, and it goes in an endless cycle like that. So a person with chronic end-stage kidney disease at the levels of fluoride that were acceptable a few months ago, 1 part per million, would end up with a quadruple amount of fluoride in their bones, which leads to, osteofluorosis. And they have a very high risk of spontaneous breakage of these bones. So anyway, that's pretty much it. Thank you very much.
Thank you, Carol. Next speaker is Dr. John Sefak. Is that right? Joan. Okay, I'm going to have to start making you guys write in print. I just can't read handwriting anymore. Apologize. Welcome, Joan. You'll have 3 minutes.
Thank you. I'm a dentist here in Austin. I've been practicing for 26 years. And I wanted to talk about fluorosis, which is a permanent problem with the teeth. It's marks on the teeth from ingesting fluoride before the teeth are erupted. So from eating or drinking fluoride when you're from birth to about age 8. So these marks can be white spots to dark pitted areas. This is usually considered a cosmetic problem, but it's actually an outward sign that the rest of the body has been overexposed to fluoride. The fluoride's a central nervous system toxin, and it damages, like you heard, the kidneys, the brain, pineal gland, the thyroid, and the bones. Makes the bones brittle, and it can cause cancer in the bones. The schools are actually using the fluorosis as a sign to monitor their athletes because they know that these kids are more prone to bone fractures. The problem is these effects are cumulative. So the more you ingest, the more it accumulates in the organs. And ladies, it causes wrinkles because it breaks down the collagen and causes premature aging also. Currently, there's a lawsuit against Nestle and Gerber Foods. The parents of a 13-year-old girl has fluorosis, and 90% of the water that she drank from birth to age 13 or age 8 was from Nestle's, and it was touted as being good for the teeth because it had fluoride. And the fluoride content was 0.8 parts per million, and Austin's is 0.7 parts per million. And she has fluorosis. I'll give you the pictures afterwards I have of her teeth. They're suing for damages and for placement of veneers and for replacement throughout her lifetime 5 or 6 times and for pain and suffering. So I think it would be, since this lawsuit has set a precedent, I think it would be very wise for the council to approve a warning on the water label about the water and the fluoride in the water.
Next speaker is Dr. Alan Johnson. Welcome, Dr. Johnson. You'll have 3 minutes. Thank you.
I am a scientist and engineer with more than 40 patents and publications and books, and I understand reading scientific documents and ferreting out what is good and what's bad. So with that, I'm going to tell you a lot of the science that I've reviewed. First of all, my teeth are a testimony to not having fluoride in toothpaste with fluoride. Thanks to Dr. Griffin Cole, who I think will speak later. He helped turn my health and teeth around. I had serious problems about 20 years ago, including gingivitis and a couple of strokes and other problems that I had. So a little of the scientific evidence. There's scientific evidence that fluoride contributes to Alzheimer's, and that's on the increase, including among young people. There's scientific evidence of poison to the kidneys, as you've heard, and of course you already know about the warnings that have been given in terms of causing fluorosis. There's also many people who are living in communities who are ingesting the fluoride at a level that is on par with what doctors use to reduce thyroid problems where they have hyperthyroid patients. This reduction contributes to hypothyroidism, which is underactive thyroids. And the symptoms for that are obesity, lethargy, depression, heart disease. And what do we have among our people? According to the National Toxicology Program, the preponderance of evidence from laboratories in vitro studies indicates that fluoride is a mutagen, which you heard earlier, which means it can cause genetic damage, which means it can cause cancer. We've had prominent African Americans, such as Ambassador I'm sorry about that, Ambassador Andrew Young, as well as Bernice King, the daughter of Dr. Martin Luther King, who've come out strongly against fluoride in the water.
Thank you, Dr. Johnson.
Thank you.
The next speaker, I can read the first name. It's Blessing. And I think that's such a pretty name. I'll just stop there. Welcome, Blessing.
Thank you. Hi, my name is Blessing, and I'm a chiropractor, and I also have a master's in nutrition. And a couple of the points have already been addressed, but I'm just going to go over them briefly. Fluoride actually is thought to increase the absorption of aluminum, and that is also linked to Alzheimer's. Fluoride also increases bone deformities, bone fractures, and it also increases the chances of bone cancer. Several studies have linked fluoride to as many as 10,000 cancer deaths per year, with the high incidence in bone cancer. And in 1990, fluoride was found to be a carcinogen by the National Cancer Institute. And the last one is hypothyroidism. In patients or clients with low iodine intake, fluoride actually causes causes hypothyroidism. And basically, signs of this are loss of mental acuity, depression, and weight gain. And that's it.
Thank you. Next speaker is Dr. Neil Carmen. Welcome, Neil.
Thank you for the opportunity to speak. This chemical that the city adds to the water is a very toxic substance. And one of the points I wanted to make here is the fact that this compound, hydrofluorosilicic acid, is not naturally occurring, and it's much more toxic than lead. You know, we put lead in gasoline for 50 years until we found out that it causes brain damage and retardation and lower IQs in children. So we took it out, and lead levels fell dramatically. But this compound that the city's adding is actually many times more toxic than lead. It's nearly as toxic as arsenic. So why would you put something that harmful in the water supply? Actually, a number of years ago, the Environmental Protection Agency was asked if there were any health studies on these silicofluorides. That's what this hydrofluorosilicic acid is. And EPA wrote back a letter and said, we have no health studies on this specific group of chemicals called silicofluorides. So when you're talking about risk to infants, there is a risk because this is such a highly toxic substance. It's highly reactive. And also there's evidence that when it's in the water, it encourages the leaching of lead from plumbing systems to go into the water supply. So children get increased lead exposure from the presence of the fluoride in the water. There's actually several studies by Dr. Copeland's group published in the Journal of Neurotoxicology in the last 10 years. And what they showed was that, the levels of fluoride and lead in the water were linked to elevated blood lead in children, elevated urine levels of lead, and lower IQs. There's actually several dozen studies now linking fluoride to lower IQs in children. And so, this is a big issue that hasn't really been evaluated by the city in the interest of saying, well, we want to protect cavities, but what about lowering a child's IQ? I think this is really unacceptable, and this is why there needs to be a warning label on the city's water that infants and young children should not be drinking this water because it's a lifetime effect. If you have a lower IQ, we don't know how to reverse that effect. So, and as you've already heard from Carol Vanderstoep, we retain a significant amount of the fluoride. The kidneys only take out about 50%. So you need to look at, what you're doing, and you need to protect the infants in Austin and put this warning on the water bill. Thank you.
Councilmember Riley.
Dr. Carmen, could I ask you just a question or two? You mentioned silicofluoride.
Yes. Okay, because this compound, hydrofluorosilicic acid, it has silicon in it. It has 6 fluorine atoms, 2 hydrogen atoms, and a silicon atom. So it's called a silicofluoride.
Okay. How does that compare with sodium fluoride that's used in toothpaste?
Well, it's a fluoride compound. It's very toxic, but this hydrofluorosilicic acid has 6 fluorine atoms in it. Sodium fluoride has many fewer atoms, okay? So, it's also, sodium fluoride is very toxic, and I don't recommend that being used. They're both very toxic substances, okay? If you had a bottle of this in a laboratory, you would see a skull and crossbones warning label about the fumes getting on your skin, but sodium fluoride and hydrofluorosilicic acid are both highly toxic substances.
How come we don't see warnings on tubes of toothpaste that use sodium?
Well,
Hang on, folks. We're not going to have outbursts, please.
Yeah, there is a warning.
Questions.
There is a warning. Several decades ago, it was a skull and crossbone warning label, but the companies went to the FDA and said, we don't like this, so now it's some words on there that if a child is exposed or swallows a little bit of this.
It does say, it says warning: keep out of reach of children under 6 years of age. And I'm just looking at.
I
just grabbed a tube of Crest toothpaste, and it
but
says,
I don't
and then it says, if more than used for brushing is accidentally swallowed, get medical help or contact a poison control center right away.
But that's
Which is a little different. I'm sorry?
That's not sodium fluoride in there. I think it's a different
It
fluoride.
says active ingredient sodium fluoride.
Okay. And some of them they use another fluoride compound. Okay. Those, I will say, are also usually pharmaceutical grade, so they have a higher degree of purity. The compound that the city buys is actually kind of a toxic cocktail. It's got lead in it, mercury, arsenic. It's got some other fluoride substances in it, so it's not a pharmaceutical grade substance at all that the city adds.
Okay, thanks.
Next speaker is Ray Nadler-Olnick. Welcome, Ray. She is on the list. Welcome, Debbie. She's way down on the list, though. We may not get to her.
Good afternoon. I received my Bachelor of Science degree in nursing in 1978, became a member of Life Extension that year, and in 2007 completed health counselor certification from Institute of Integrative Nutrition affiliated with Columbia University. I overcame many serious health challenges through research and the removal and avoidance of toxic chemicals. I have read about and very concerned about the hazards of consuming unrefined toxic waste products of phosphate fertilizer production. The majority of my 38 years in the nursing field have been in the care of children. I'm here to share my observations with you. Our children are sicker than ever. More cancer, neurological impairments requiring total care, seizures, low thyroid, obesity, kidney problems, including dialysis, arthritis requiring steroid injections under anesthesia, on and on. I read that fluoride affects the brain's pineal gland, decreasing melatonin. So many parents are giving their kids melatonin to try and get them to sleep, especially the neurologically impaired autistic spectrum kids. I read their neurologists are prescribing this. I read about fluoride decreasing the brain's pineal gland's ability to produce melatonin. We need melatonin, adequate deep sleep, to produce growth hormone. This is our repair hormone. I see so many kids on prescription growth hormone therapy due to small or short stature. Is this related? I commonly see kids with abnormal chromosomes, damaged DNA, and a myriad of health problems. I read that the risk of serious chromosome damage is enhanced even in fluoride doses determined to be safe for drinking water by the Public Health Service. I read that this safe dose has been sufficient to turn normal cells into cancer cells. I have the book by the MD cancer specialist. I see so very many kids, including infants, being diagnosed with all types of cancer. A preschooler was diagnosed bone sarcoma recently and had part of his leg bone removed. I knew of a teenage boy who could no longer walk after his bone sarcoma was removed. He was on an antidepressant in a wheelchair while his friends were playing sports, chasing girls. I Googled cause of bone sarcoma and went to a law firm website dealing with fluoride-induced bone sarcoma. Fluoride inhibits the ability of the thyroid to concentrate iodine. I see so many kids on thyroid medication. Thyroid controls your metabolism. When it's underactive, you can have depression, allergy, which we see tons of, reduced immune suppression. We have immune system doctors, brain fog, decreased IQ, weight gain, numerous problems, heart disease. With obesity rampant, we can't afford weight gain. It leads toward diabetes, blindness, kidney failure, dialysis, amputations, disability, stroke, and death. The human body was designed to run on pure food, water, exercise, sunlight. Austin needs to demonstrate leadership in protecting our mental and physical health. Thank you.
Thank you, Ms. Birch. The next speaker is Dr. Cole. Welcome back, Dr. Cole. You'll have 3 minutes.
I appreciate it. Every time I've either spoken to you guys or met in private, I've always tried to present the science, and I've been doing that for now almost 19 years. And today, I think I just wanted to appeal to your common sense. I don't have to be here. I reschedule patients so I can be here for this. I meet with our group here in town, oftentimes a month, to get that's time away from my family. I could easily just side with my brethren in all of organized dentistry and just accept what I've been told for my whole career, that fluoride is perfectly safe and that it's one of the greatest accomplishments to mankind in this last century. But I like to read the science. I like to look at what's really out there on this, and I have yet to find anything that validates that this really works. And, Dr. Carmen mentioned that there's a topical form, which is usually sodium fluoride. If people want to apply that to their teeth, I have no problem with that. I don't personally recommend that, and I don't preach that in my practice. But to not have a choice with what's in your water, I think, is a travesty, because the accumulation is more than people really realize. When you see the modeling on the teeth, which is what I see on a daily basis, that's just the outward appearance that we can finally see. Systemically, there's already been so much damage done that we really don't know everything that's gone on. All the kidney comments, all the thyroid comments, all the pineal gland comments, they're all valid. And so I just think that, for 3 years now, we've been meeting with you guys and talking, and we're trying really hard to be very civilized about how to do this. I mean, we have inundated you guys with science now, and I think it's just time to hopefully get you guys to now do the right thing, because again, I feel like I am, and I'll continue to take time away from my practice and my family to be out here to speak for this. But I just want it's easier to not do it. So I'm hoping you guys will take the more difficult route as well, and let's get the warning on the label on our city bill, and let's just get it out of the water. It's time.
Ma'am, I realize that you're extremely passionate and concerned about this, but if you do that again, I'm going to have to ask you to leave. Please, just let everybody speak. The next one is Jason Wachowski? Sorry, Jason. Wachowski. Welcome. You'll have 3 minutes.
So, as I stated, my name is Jason Wachowski. This is actually my first time speaking. I currently work at Applied Materials. I've been there for 15 years with degrees and backgrounds of economics, engineering, and business. And like was just mentioned before, there's plenty of data out there showing why it's bad. I think that the intent here is to give people a choice, right? We're currently allowing people just to drink the water, going out and purchasing their own water, to avoid the fluoride contaminant. So having a warning label just educates the people to say, hey, there's something I need to look at, to be aware of. So that's pretty much all I have.
Thanks. Jason. I noticed a lot of new faces. How many folks are down here for the first time? So just want to remind you, or let you all know if you don't know, that your parking can be validated and it's free for being a part of this meeting. So make sure you get it stamped in the city clerk's office so you don't get charged on the way out. The next speaker is Dr. Laura Presley. Welcome, Dr. Presley. You have 3 minutes.
And I may get emotional. This issue is so painful for us to deal with. Like Dr. Cole, I don't want to get up here and talk about the science. I mean, the science is there. What I want to say is that, and this is the tender part of this, we're all connected. All of us, everybody here, you guys, we all drink the same water. We all shower in the same water, and you can't get away from it. What we're asking is that you please inform the people that do not already know about this, and that there are sensitivities out there for infants and children, and that's the warning that we're asking for. We're all part of this community, all of us. And I try try to put myself in your role. How would I make this decision, and what do I look at? And it's hard because there's so much conflicting information. You're being told by the federal government, by the CDC, what a great thing this is. You're being told by the American Dental Association and by the medical associations how wonderful this stuff is. But I want to ask one question. They went back and said, you know what? Gosh, the level's at 1.2 ppm. We were wrong for decades. We're now going to put it at 0.7. Randy Shade asked the absolute best question when we had the debate with Dr. Connett and the Fort Stockton doctors that came. And she asked them, 0.7, how did they come up with this? How did the CDC come up with this? She asked Dr. Wong this. The response was not, here's the data. The response was, this is what they thought was best. That is very alarming. So if I were you, I would look at something that's very intuitive and something that is what I would call a self-evident truth, that there's no dose control. Infants, children, people with hypothyroidism. I had hypothyroidism. I don't anymore. I've stopped drinking fluoridated water for 3 years now, and I don't take medication that I was taking 10 years. I know, Councilmember Riley, you have hypothyroidism. And I was sick and tired of dealing with the medication because it kept going up and down, and I couldn't control it. And it was just frustrating. So I fixed the root cause. I want you guys to give that choice and that information to the population here in Austin. And it's in your hands. And since you're showing Councilmember Tova, when we met with her, she says, well, how do you define overexposure? And you can't. It's individual. We're not guinea pigs. Decades from now, at 0.7, is the CDC going to lower it some more? I'm not an animal and I'm not a guinea pig. I'm a human being. And I have a voice. And we're here, everybody here is speaking loudly, and we hope you hear us. Thank you.
Dr. Presley, I wanted to ask
you.
So I just want to be clear, because you're the second speaker that said something that I think I'm hearing differently than what I've heard in the past.
Okay.
And so you said, and along with another speaker said, we would like a warning as it relates to infants and children.
Yes, that's the warning we have given you.
Right, but do you want it specific to infants and children? Because my understanding is you simply want a warning as to the hazards of the type of fluoride that is put in the treatment.
Very good question. And what in the warning that we have provided the council, every single member has gotten this. We're not pulling, it's what I would call a middle of the ground warning. It is not targeting hypothyroidism. It's not targeting kidney disease. We are asking you at minimal to put a warning of the words of your own people that you guys are referencing. The CDC, it's wording from the CDC. It's wording from the material safety data sheet of the supplier. Okay, the supplier has now warned that there's fluorosis issues and osteosclerosis issues when people are exposed. And then that warning also says during enamel formation is when these things are critical. That's children. That's infants and children. At minimal, we want that warning. We would love to have a warning that says people with hypothyroidism are sensitive, people with kidney disease are sensitive. Is that clear?
That helps. I appreciate it. Let me take it a step further.
Okay.
What if it is a notice and not necessarily uses the term warning? What if it is an official notice with specific language that we have discussed?
I think that would be, notice would be good, but we want minimally the wording that we gave you.
Okay.
If we don't get that, there's going to be a lot of angry people.
Sure.
Okay.
We get a lot of those.
I know. Thank you.
Fine. Councilmember Riley.
Yeah, Doctor
Presley, we have more questions.
Do you know of other cities
Yes,
that
sir.
have issued cities? Do you know of other cities that have issued similar warnings?
No, and I think what's happened now is because the material safety data sheet, the Mosaic Company is the major supplier in the country for this hydrofluorosilicic acid that Dr. Carmen was talking about. This warning, they added to their material safety data sheet only in May. So right now, there are other cities across the country that are doing the same thing. People coming to their city councils requesting a warning. But no one. I don't know of anybody that has done it yet.
Are there health organizations that have endorsed this warning?
I do not know, but
Okay.
the issue is that your supplier is telling you about it. Okay? You purchase chemicals from them, and actually they have now transferred the legal liability onto the city of Austin. They've pretty much washed their hands. Once they warn you, they are not liable for being sued. So that's really probably the reason that they put it on, because of all the lawsuits that are happening right now.
Okay, thanks.
Okay, but good question. Thank you.
Ma'am, in the red shirt, you seem like you have a lot to say. I'm going to invite you down next to speak. You can just introduce yourself. Welcome. Hang on. No, you may not unless somebody asks you. Come on down, ma'am. Introduce yourself. You have 3 minutes. You seem to be pretty good from the middle of the audience down there.
I've been hearing so many of my friends that come down here and talk to y'all, and they would say, well, they were just reading things and turning their heads, doing other things, and laughing when they had doctors talking about how bad this is. And it made me angry that you ignore us. How much are they paying you to continue to poison us? It's obvious somebody is getting a lot of money to be keeping on and causing all of these thyroid. Look at me, I'm fat. And it's probably because it's ruined my thyroid, causing sugar diabetes and all the other things, and it's all fluoride. You already heard someone that's sick and has had to go through all kinds of hoops to get rid of it. I spend a lot on my Berkey water filter, but when I go out and eat, I can't get rid of it. I carry my own water in so that I can have fluoridated water. I don't understand why you're so hard to get through to you. What do we have to do? There are people outside, and they're mad about a lot of things. The government's decided to turn their face, hear nothing, see nothing, and keep on doing whatever they want to do. And we're tired of it. We want action. Stop cuddling poison people. They want to kill us. And stop cuddling it. Because we're mad. Please.
What was your name, ma'am? Second.
Janice.
Janice what?
Liverman.
Thank you, Janice. The next speaker is Mr. Bill Swale. Is Mr. Swale? Okay. All right. Is it Jeremy Weissman? Is that right? Jeremy Weissman. Welcome, sir.
It's going to be tough for me to follow that one. But good afternoon. My name is Jeremy Wiseman. I'm a family practitioner here in Austin. I did my medical training at UTMB in Galveston and my residency at UTSA located in McAllen. And I've been at a private practice here for 2.5 years. I was trying to think of last night on how many issues I actually, personal and medical, that I have with fluoride. And actually, I got to 12 and I was in my bed and I just fell asleep. I've got a bunch, and I'm going to focus on a couple today, and I think most of them have been covered today. But the two medical issues that I have, I deal with daily and on a personal level, and I think that they're very common sense. I mean, I think right now there's a lot of science here, and both sides have their science, and like a few people have said before, I can see that being very frustrating because you guys aren't scientists and it's tough to know who to believe, and I think there's good science on both sides. I, of course, think the science is better on the anti-fluoride side, but I think it's important to keep it very, very common sense. There's an old adage in medicine that says that most good medicine is common sense medicine, and I think that's true, and I think as far as fluoride, that's completely been lost. It just doesn't make a lot of sense to me. The first thing I want to do is establish if it's a drug, and I guess Bill's not coming. So Bill owns People's Pharmacy, and he's talked about this a few times, and I don't think there's a question it's a drug. I mean, you can't get it over the counter. You need a prescription to get it, but nobody's going to use a prescription to get it because nobody wants it because it's so toxic and there's really no use for it. But and so there's no question it's a drug. And so having said that, the two issues I want to talk about today are dosage control and informed consent. And this is basic kind of medicine 101 here, and that goes for the American Dental Academy or the American Dental Association and also the AMA. Number one, again, dosage control. If a patient came in with her infant, and I gave, let's say it was, for an upper respiratory infection, and I gave the infant the same amount of amoxicillin, let's say, that I would do for her mother, like 500 milligrams 3 times a day. At the very least, I'm going to get my license pulled. Okay. At the very most, I might even kill the child. So we are completely missing dosage control as far as fluoride is concerned. There's no way you can control it. I mean, with the standards right now. On top of that, with infants, I mean, infants obviously have a liquid diet the first 6 to 12 months of their lives, and so they consume obviously more water with formulas than the average adult per day. Obviously, that's per body weight, but and so obviously infants are getting affected, and that's a crucial year in one's life. And then athletes drink more water. I mean, it never really ends. I mean, it's very tough to control this, and we obviously live in a very active city. Is that my time out?
You can conclude your thoughts.
Okay. Anyways, I got a few things there. The other one is informed consent, and this also is being missed in the conversation. If a patient comes in, I'm going to give them medication. First thing I need to tell them is what medication I'm going to give them, and then we talk about risks, benefits, things of this nature. Informed consent has been completely thrown out the window. Patients have no clue that some know that fluoride's in the water, but most have no clue about the risks, the benefits, exactly what's going on. And I think that's number one, unethical, and it should be illegal. So. I've got a few other things, but I got to wrap it up. But anyways, I thank you for your time, and I think these are some issues we need to consider.
Thank you, Mr. Wiseman.
Thank you. Right.
Councilmember Riley.
Yep. Dr. Wiseman? Is Dr. Wiseman?
Yes, sir.
Yeah. In your view, should we attach any weight to recommendations from groups like the American Dental Association or the American Medical Association on the issues related to fluoride?
So you're asking me if we should follow their guidelines?
Or attach, I mean, to what extent should we be concerned about their recommendations?
Well, first of all, anything. I think anything. I mean, at this point, we'll take anything, right? But, I mean, the problem with going with them is they're historically wrong on a lot of things. And so I'm part of,
I'm just trying to sort through. I mean, I appreciate your points, the points you raised with respect to dosage control,
right,
and informed consent.
Right.
And I would expect that those issues are of concern to groups like the Medical Association and the Dental Association.
Sure.
When they come forward with recommendations on fluoride, how should we view those recommendations?
Well, it's more you're talking about the Dental Association here, probably. I don't know really any recommendations from the American Medical Association, but I don't know, and I don't know. I think there's obviously a lot of deep pockets here, and I think there's obviously people, obviously organizations that are kind of in bed with each other, so to speak. So I don't want to sound too conspiracy here, but I usually take those recommendations with a grain of salt. I mean, case in point, I mean the fact that fluoride has been put in water, I mean they're completely wrong on that. And again, like Cole says, I have no problem with topical. I mean, I use it in my toothpaste sometimes, but the point is I don't have a problem with topical application. But as far as drinking it, I just don't quite understand that. So their recommendations of having any fluoride in there just doesn't make any sense to me. So I don't know if I'm answering your question, but I just like I said, I would take any kind of warning label, even though I think the fight really isn't going to be over until it's obviously not put in water at all. But I think, like I said, I mean this is a process. I understand that we're not going to go from today to it's not in water. I get it, but yeah, for you to ask me, what warnings should be put on it, I'll take anything at this point.
Okay.
So
Thanks.
I don't know if I answered your question, but
Well, I'm trying to process to
Yeah.
what extent we should be concerned about that, and thinking that through.
Well, and also
thinking that
both
through,
of-
I have to consider the groups like the American Dental Association, which take issues. I assume take issues like dosage control and informed consent fairly seriously, and
that's the point.
still
Is that
come
you
out.
would think. Well, you would think with, again, these basic rules that any medical student's going to know. Dosage control, informed consent. You would think, and that's my point here. It's so common sense. Why are they not doing that?
Right.
Now we start getting into some really interesting issues, obviously, as far as money, as far as groups. They made, if they've made a decision for 30 years, they're trying to save face. They don't want to go back on it. People aren't dying right now because it's not an acute toxin. You understand? These things happen over 30 years, and so it can't be proven. And so they're able to kind of sneak out of it. But
Okay.
so I think it's very complex. I agree, and I don't have a perfect answer.
Okay. Thanks.
Okay. Sorry. Thanks.
Next speaker is Linda Green. Welcome back, Linda. You'll have 3 minutes.
Got them validated. Can you hold up your hand? Okay, Dr. Cole needs his parking pass back. Okay, sorry about that.
Nope, it's okay. Thanks.
Okay, so we're really here gathered to ask y'all to put this warning label on the water bill. And you were actually given this request for a warning label on the water bill back, I think, in July 23rd, and now it's going on October 23rd. And we really at Fluoride Free Austin don't understand why you're dragging your feet, City Council in general. The first time it was, well, we don't know if we have room on the water bill, and then how much is it going to cost to put it on the water bill? Recently, we took our website, where you go to www.fluoridefreeaustin, and under the Take Action tab, we put a letter for people to say that they're in agreement with these concerned citizens of Fluoride Free Austin, that is the duty of our mayor and city council to immediately vote to put a warning label on all water bills, given the past 3 years of presenting irrefutable scientific evidence to our city council via citizens communications, videos, documents such as the recent Mosaic Company's MSDS sheet warning itself, as well as Fluoride Free Austin's resolution, which we're passing around to companies. We've given you various forms of damage cited by the CDC, the NRC, the FDA. It's like the lady was saying, how much evidence do we need for y'all to take action? And then there is the actual warning. In January 2011, the CDC lowered the maximum level of fluoride recommended from tap water from 1.2 parts per million to 0.7 parts per million. One lady said, well, fluoride was used in rat poison, so if this much rat poison is bad for you, then how is half that much rat poison good for you? And on the warning label, it says prolonged or repeated overexposure to fluoride compounds may cause fluorosis. Well, when we shower, we bathe, we drink teas, coffees, soups, all the liquids we intake having fluoride, that's prolonged repeated exposure. Fluorosis is characterized by skeletal changes. It causes crippling arthritis. I'm 62 years old. I don't need some ingredient in my water that's going to cause thyroid disease. My grandmother and mother had thyroid disease. They had cancer. I'm at risk person. So why would you keep adding this ingredient that doesn't even make teeth strong? It makes them brittle. My tooth broke off not too long ago because our own Health and Human Services this year, as you know from this document that you received, reported that it causes risk of bone fracture and brittle bones. Now, just a couple of weeks ago, College Station, 6 out of 7 of their council members had the integrity to vote it out, sitting in a college town of Big Agra. And we want you to stop standing for Big Agra, Big Pharma, and stand for all these people and citizens here. Do it now.
Thanks, Linda. Next speaker is Cindy Fierson? Sorry, Cindy. Fireisen. Welcome, Cindy.
This is my first time to appear, and so good afternoon, and thank you very much for allowing this dialogue with the citizenry of Austin. I've been a resident of Austin for 25 years, and I am a chef by trade, and I pride myself in preparing the best foods and beverages possible, not just for myself, but for my clients. And I'm always shop in the farmers markets. I want the quality. I want as organic as possible, and I don't want chlorine in my water either. But I definitely don't want fluoride, because what I can definitely get the chloride out the chlorine out from filtering, but it's harder to get good fluoride filters for caterers and for facilities to get that product out. Anyway, I also have had health issues. I've had hypothyroid problems, and I also have brittle teeth. And my brittle teeth have happened while I've been a resident of Austin. So I spent a lot of money on dentistry over the years, and I'd never really understood why my teeth were brittle. I think it's because I spent a lot of time drinking Austin tap water, even with my Brita filters that I could get the chlorine out and other heavy metals. So that's just enough about me, but I also have several friends and also two family members that grew up around Austin, drank the water and whatnot, and they both have dental fluorosis. And they are also now newly pregnant. So I worry about the future of those babies, because my family members already suffer from, and they're in their 20s. One's 20 and one's 24. So I really worry about the health of those babies. And I really encourage putting a warning on the utility bills. Thank you.
Thank you, Cindy. Next speaker is Clay Defoe. Welcome, Clay. You have 3 minutes.
Good afternoon, ladies and gentlemen. I've come here to speak to you today about the dangers of water fluoridation in the city of Austin's drinking water supply. It has been abundantly clear through many studies by obviously top-level doctors and toxicologists that fluorosilicic acid is a dangerous compound and one that is absolutely not necessary for our water. There is no reason why fluorosilicic acid should be added to my water. It has been proven to cause dental fluorosis in children and adolescents, as well as other ailments. A professor from the Ivy League school, Dartmouth University, Dr. Roger Masters, has determined the inherent danger of water fluoridation. The results from his study of New York school children from 1994 to 1998 showed that fluorosilicic acid did not only not help dental hygiene, but is linked to higher levels of lead in children. In addition, Dr. Masters investigated how the levels of lead put into the brain can alter brain chemistry and harm individuals. Dr. Masters asked, shouldn't we stop intentionally exposing 140 million Americans to an untested chemical until the risks are extensively and objectively evaluated by independent researchers? The fact that doctors from the highest respected universities of the world have concluded water fluoridation is not safe proves there is a real danger and a real health risk that must be investigated and acted upon immediately in order to protect the citizens of Austin, Texas. In Prague, Czech Republic, and Bohemia, where I used to reside, fluoridation is banned, and neighbors band together to protect their clean and near pristine drinking water. We would be remiss not to investigate the hard and clear evidence against fluoride in the water, only to completely ignore the very serious health risks that it presents. Please protect our community, our rights. Please follow the lead of College Station and vote to end water fluoridation in Austin. Thank you.
Ray, since we still have some time, would you like to come back and speak to us, please? Next speaker is Ray Napter Olnick. We've got clip rolling too. You can get it online, on demand.
Secondhand smoke contains 7,000 chemicals, including cyanide, lead, and arsenic. 7,000 chemicals. That's harmful, whether it's inside or out. To find out more, go to livetobacco-freeaustin.org.
Okay. The 30-second clip we just played cost the city of Austin $186,504.25 to make, 4 times the highest annual salary I ever earned in 40-plus years of full-time employment in the workplace. All to tell people what most have known for 60 years, that cigarette smoke isn't good for you. Meanwhile, the city frets about the cost of printing a health warning about fluorosilicic acid on the monthly utility bill. Yes, I realize that TV ad money came from grants. In fact, from the CDC, the same distant federal agency that aggressively promotes water fluoridation. Coincidence. Okay, in a way, cigarette smoke and fluoridated water are a lot alike. Both are pollution foisted on a lot of people who don't want them by a minority who do. But while people who want tobacco, only the people who want tobacco have to pay to purchase it, everyone is obliged to pay for fluoridated city water through taxes, and those who don't drink it pay a second time for a supply of purified water if they can afford it. Both tobacco and fluoride are slow-acting cumulative poisons. One puff won't hurt you. One glass won't hurt you. Tobacco stains the teeth of adults. Fluoride stains the teeth of infants and children. Tobacco, over time, causes lesions that show in x-rays as spots on the lungs. Fluoride, over time, produces the kind of bone damage that doesn't show up in x-rays. Dental fluorosis is the outward sign of what's going on invisibly with your bones inside. So, committee, please do the right thing. I have confidence that a city with funds to throw around on projects like that can come up with the money for some extra ink. Thank you.